Welcome to Get the Facts, the program that provides you with information on the latest topics. I'm Theodore Henry. Today we are discussing fatty liver disease. It's a condition affecting many individuals, often without their knowledge. According to the National Library of Medicine, it is the leading cause of liver disease worldwide. And joining me is consultant gastroenterologist Dr. Mike Mills to shed light on this silent ailment. Dr. Mills, welcome to Get the Facts.
Thank you, Theodore.
All right.
Happy to be here.
Let's jump right into getting some facts.
Yes.
Fatty liver disease. I don't know that when people hear liver, they think about fatty liver disease. So give us the definition. What is it?
Okay, so first you need to understand where the liver is and what the function is. It's a very large organ. It's not a paired organ. It's a single organ sitting on the right side, just below the rib cage. It helps to process a lot of things in the body. So a lot of people associate it with breaking down waste products, for example.
Okay.
That's one aspect. Deals with bile processing, forming bile, and also associated with breakdown of drugs. Anything that has to be processed through the body goes through the liver. So it has a very important function. But of course, it can go wrong. And one of the things that can happen is that fat can build up in the liver.
Right.
Fat happens all over the body. It's a normal part of the process. It's useful. But if it becomes excessive, it can be associated with inflammation. So buildup of fat in the liver is what was referred to as fatty liver.
Okay.
So that term is actually not used anymore.
Yes, you said was.
Yes, was. So over the last year, the international community in medicine has actually looked at this term and recognized that fatty liver can be stigmatizing. People don't like to be labeled as having fat or being fatty.
Right.
And so for that reason, the term has actually been changed to metabolic associated steatotic liver disease, which is a mouthful.
Steatotic liver disease.
Yes. And it's shortened as MASLD, M-A-S-L-D.
Okay.
Yes, still a mouthful, not as easy to recognize as fatty liver.
Right.
But the steatosis is the medical term for fat. So that's why it's in that name. So metabolic, because it's associated with metabolic conditions like diabetes and obesity.
Okay.
It's associated with steatosis or fat, and it's a liver disease.
Okay, so it's more accurate.
Yes, exactly.
More accurate in its naming. But you mentioned the name, and I also want to talk about the actual symptoms. What does it present? Are there any symptoms?
Very often individuals do not have symptoms of fatty liver. Because the liver is associated with some inflammation, sometimes you can have discomfort in the area where the liver is, but most individuals will, right, so on the right side, just below the rib cage, if it's very enlarged. Outside of that, however, you have no symptoms. Most individuals pick it up only because they've done an ultrasound, for example, or they did some blood tests looking at the liver, and they show some inflammation.
Right.
So it's very unusual to have symptoms unless it's very, very late. Because you can have complications associated with fatty liver disease, which will present with symptoms much later on. And those symptoms could be jaundice. You could have features of cirrhosis, so you get swelling in the abdomen. You may have very large veins in the gullet or esophagus called varices, which can bleed. Patients may become confused. You may go on to have liver cancer, liver failure. So all of these symptoms are very, of course, serious. But of course, the majority of individuals may not progress to this stage. And so in the early stages especially, you're not going to notice anything at all.
Early stage, late stage, what's the average timeline on this sort of?
It varies. So it could be anywhere from 15 to 20 years from developing excess fat in liver, a condition called steatosis, to the point of having inflammation. So that's hepatitis, inflammation of the liver, or steatohepatitis. Going on from there to have scarring, because the liver is going to try and heal itself from the fat. It's going to heal with scarring, and that scarring can become what's called cirrhosis. And then ultimately from there, you may develop liver cancer. So that process takes about 15 to 20 years.
Right. So how do you mentioned ultrasound. Is that the only way you diagnose fatty liver? MASLD?
Yes, or metabolic associated steatotic liver disease.
Okay, so I'm not going to refer it again. But how do you diagnose it?
Okay, so
outside of ultrasound, if that's not the only way.
Blood tests are useful to suggest that there's inflammation in the liver. So your routine executive profile normally looks at that aspect of it and may pick it up.
Right.
Outside of that, you can actually do a specific type of test called a fibroscan or elastography, which looks at how much fat is specifically in the liver. An MRI may also pick it up, or in severe cases you may have to do a biopsy if you're not quite sure, or you sample the liver to see exactly how much fat is there. That's not usually necessary, and most cases are picked up quite readily and accurately on ultrasound or on scanning with a specific machine for that.
Is this a everybody and anybody sort of ailment, or is there a most at-risk subset?
Okay, so most individuals can develop fat in the liver. The most common association is going to be something to do with the metabolism. So obesity and diabetes, those two in particular. A majority of individuals with type 2 diabetes will be at risk for fatty liver, and a lot of the data suggests that up to 60% of patients with diabetes type 2 will have fat in the liver, 60%. Regardless of whether they're obese or not. Yes, having obesity increases that risk even further, and the more obese you are, the higher the likelihood of having fat in the liver. There are other causes of fatty liver also. Some viruses can be associated with fat in the liver, hepatitis C, for example. Certain medications can also predispose you to having fat in the liver. And the big one outside of these would be alcohol. So alcohol use in small, moderate, large quantities is associated with fat in the liver as well. And that's the process by which alcohol can go on to cause cirrhosis and its effects.
Oh, so this fat in the liver, this ailment is sort of it's on the way to many other things and is caused by other things. So you have diabetes, you can develop this. In addition, you're a heavy drinker, you can develop this. You are chronically obese, you can develop this.
Yes.
It comes in a sort of package and increases complications.
That's right.
And based on the ailments that you mentioned that stem from this is a sort of, it is a lifestyle disease to some degree, and also it leads to further lifestyle complications, diminishing the quality of life.
Correct.
And why I went through all of that is I'm trying to get to that point where we say, why should we care about this thing?
A very significant condition. It's increasing in prevalence. So as obesity and diabetes, other lifestyle conditions, high cholesterol, all these things are associated with adverse outcomes.
Yeah.
So as they become more prevalent, fatty liver, what was previously looked at as potentially not even a significant condition, recognize that it's now associated with significant liver issues and also an increased risk of heart attack, increased risk of stroke, worsening outcomes in diabetes and other conditions which previously would not have paid that much attention to. It's not a condition to be ignored at all.
Thank you for that. Thank you for that. We're going to keep talking about this, but we're going to go to a break now. We're discussing this with consultant gastroenterologist Dr. Mike Mills. So please stay with us and meet us again on the other side of this quick break.
Know your numbers and control the keys to a healthier heart. Know the numbers for your blood pressure, cholesterol level, blood glucose level, and your weight and body mass index. Find out the risks they represent and what you need to do to stay healthy. Talk to your doctor and start making healthy lifestyle choices to prevent a heart attack or stroke.
Welcome back to Get the Facts. We're continuing our discussion with consultant gastroenterologist Dr. Mike Mills about fatty liver disease, though he did update the name and gave us a more accurate name, but I'll leave it to him to put it out there. Dr. Mills, so we have drawn a line and answered the question, why should I care? Right? So our audience is now thinking, okay, I have this, I have that, I have this predisposition. Perhaps I need to go get an executive profile done, an ultrasound done, whatnot. You also gave us the time frame, 15 to 20 years for development, early stage, late stage. What do I do about this?
Yes, so the first thing, as you say, is to be aware that you're at risk, and then to take steps to confirm the diagnosis. And once that is done, then you need to have some intervention.
Okay.
So the first intervention is usually going to be recommended lifestyle change. So we check your metabolic profile.
The hardest medicine, by the way.
Yes, very difficult to sustain, but easy to identify what the factors are which are causing the lifestyle to be abnormal. So because it's lifestyle, of course, it requires a significant thrust to try and modify it. So one of the key things is to look at what you're eating, for example. So diet plays a significant role in the development of this condition. And if you're having a diet which is very high in calories, very high in fat, very low in fiber, a diet which is not a fresh fruit, vegetables, water type of diet where you have a lot of processed or ultra-processed foods or sugar-sweetened beverages, this will increase the likelihood of developing this condition. So you need to look at the diet, ideally in conjunction with a dietitian, but it doesn't have to be with a dietitian or nutritionist. You do need to have a stock of what your daily consumption is, what your requirements are, and what other medical conditions may impact that. For example, if you have high cholesterol or if you have diabetes, that will also impact what your diet is. But you need to reduce your intake so that you can reduce the weight. Once you reduce the weight, your liver automatically will start to process the fat accurately, and it will correct the condition. So the liver is very good at repairing itself, but the more calories and so on that you put into it, it's going to try and store this as fat, and it's going to store it in such a way that can cause inflammation. So the diet is key. In addition to that, exercise goes exactly right with it. So, of course, you need to take stock of your ability to exercise.
Yes.
We recommend at least half an hour, 3 to 4 times a week of vigorous exercise where your blood heart rate is increased. Of course, in consultation with your doctor or healthcare professional, you want to know what your possibilities and your risks are, because if there's obesity, for example, you may have issues with the knees, or if there's a heart condition already. So we're not just saying go out and start vigorous exercise, don't go and run a 5K on the weekend if you're not prepared, but definitely take steps to get moving, because this will impact your metabolism and, of course, will help to control the amount of fat that's deposited in the liver and other areas as well, so to improve outcome generally. Outside of that, there are some specific targets that we tend to look at. So the weight reduction that we're looking at depends on how much fat is in the liver. So ideally, if you want to try and improve things, you want to target anywhere between 5 to 10% body weight loss. And this is over a long period of time. It can be for 6 months up to a year, depends on the individual and how severe it is. But once you get that weight down, that's a significant way of reducing the amount of impact on the body. And the liver, as you mentioned earlier, the liver now begins to correctly process the fat without the scarification. Exactly. Well, the key thing is that we want to prevent scarring. Once scar tissue is laid down, of course, just like scars anywhere else where you have an injury, that scar is likely to always be there. And the impact of the scar is that scar tissue is not functioning tissue. And because, as I said before, the liver has a lot of functions that it requires cells to carry out. If there's scar tissue there, it's going to disrupt the function. So you want to prevent scarring as an outcome, because that's the key thing with metabolic associated steatotic liver disease, or MASLD, which was previously known as fatty liver.
I can do MASLD. I can do MASLD.
That's right.
So, okay, lifestyle changes, exercise.
So those are key. Of course, sustaining them is important. There are other interventions which can be useful. There are medications which have been shown to improve outcomes in this condition. Some of the medications are used in diabetes, for example. Some of the medications are specific for the condition, but they're not approved, just been approved in the US, for example, this year. So they're very expensive, they're not readily available, but there is hope that medications will be more readily available to treat the condition. But of course, we don't have to rely on medications, which themselves can have issues. And so the key thing is to look at that. Outside of that, depending on how severe the problem is, even surgery is an option. So if individuals are morbidly obese, where the obesity level impacts their health significantly, they may require bariatric surgery, where you can reduce the size of the stomach by various methods to try and improve outcomes. And all of these methods have been shown to actually improve this condition, and also even to reverse some of these negative effects. Even the early stages of scarring can be reversed.
Okay. And your first 2 prescriptions were good, because it not only helps with the condition itself, but it's generally a lifestyle improver, diet and exercise. And we're in the tail end of the interview, but simple question before I give you that moment that I promised. Is this something that has to be managed for the rest of my life if it happens, or can it be reversed, cured?
You can cure fatty liver. So the liver is a remarkable organ. It has the ability to completely heal itself once whatever is causing the injury is out of the way. So whether it's a virus or medication or fat in the liver, once you remove that, the liver will repair itself. So the key thing is to allow it to do that by getting rid of whatever is causing the insult. And in this case, it's going to be lifestyle or whatever is causing the fat. Once that happens, then it will completely fix itself. If there's scar tissue laid down, however, a lot of scar tissue, which we call cirrhosis, unfortunately, we don't have a way of reversing that at the moment. And that's where the problem is, because of all the liver failure effects and liver cancer effects, all of those things we're trying to prevent. So we want to prevent you from developing cirrhosis or scarring of the liver to allow the liver to heal itself naturally.
Got it. They should let you do more promotions for health on the national level. I like how you said it, once you remove the insult. But Doc, we're in the very last 10 seconds of the interview. I want to give you a moment to speak directly to the audience about MASLD. Yes.
Okay, so MASLD, or metabolic associated steatotic liver disease, is something to be aware of. It's not a life-threatening condition in the early stages. Once you're at risk, you need to know your risk, take steps to reduce it, look at your lifestyle, because obviously this is something that you want to get on top of very early.
Right. And I'll reiterate the two prescriptions given to us by the good doctor: lifestyle, in diet in particular, and exercise, getting that heart rate up, of course, within the context of the rest of your being. We thank you for watching this program and for being with us. Consultant gastroenterologist Dr. Mike Mills gave us such valuable insights into what we knew as fatty liver disease, but what I now know by the acronym MASLD, which means, Doc?
Metabolic associated steatotic liver disease.
Thank you so much. Now, I'm sure all of you have gained a better understanding of this condition and where you sit on the spectrum. And we encourage you to take this seriously. Thank you for tuning in. And remember, maintaining a healthy lifestyle is key to preventing and managing ailments like these. Stay informed and stay healthy. Until next time, I'm Theodore Henry. Thank you for joining us on Get the Facts.